How could this be possible? The year of the nurse. When I think back to when COVID-19 virus reached Michigan and began pounding our health system, I remember how life began to unravel and change. We had to let go of normal and reach to the new reality, one we were creating in the moment in response to our professional and personal challenges we had never seen before. I cannot begin to know all that you have been through during the past 2 months, but I recognize some of the struggles you have faced at work and simultaneously at home. Physical exhaustion and navigating so many unknowns, kids unexpectedly home from school, how to conserve on PPE, how to get your groceries, how to protect yourself and your family, policies that evolved as we learned about the virus, patients who are frightened and without their family and like family at their bedside, caring for your own sick family members. Some of you had loved ones in the hospital you could not visit. Some of you endured personal losses of loved ones you could not memorialize through funerals or wakes. And even with all of that, you answered the call to care for our community when they needed you the most. And when the call went out to staff the new RICU to be in the center of whatever was to come, hundreds of you said, "Send me." Others found yourselves working on unfamiliar units with nurses you had never met, but at the end of the experience, you would become colleagues you would never forget. Now, as we hopefully and cautiously watch a flattening of the curve, and we begin to create a new post-COVID-19 normal, we face the financial toll of the pandemic. This week, headlines all across the nation are revealing the financial blow felt by hospitals and health systems from Maine to California and here at Michigan. By now, you have heard about the damage to our own health system and the painful countermeasures we must employ in order to continue our mission. The cuts are big and they are deep. It is hard to imagine, after living through some of the most challenging times in our personal and professional lives, that we now must face a financial crisis too. I wish it were not so. I wish I could tell you that our health system, and in particular nursing at Michigan, is immune to what the virus has done to health systems all around the world, but we are not. What I can tell you is that my number one job is to come to the tables of discussion and decision-making with razor focus and to resolve and to make decisions that preserve our ability to deliver safe and effective nursing care. Some of my well-meaning friends and family have commented that nurses should get to pick another year to celebrate the year of the nurse. I understand and I appreciate the sentiment they are trying to convey. We did have big plans for our 2020 Nurses Week celebration, and those plans have been put on a shelf. Between the need for social distancing and our new financial challenges, it was a necessary decision. But to my well-meaning friends and family, and to anyone else who would ask, I would say 2020 is perfect for the year of the nurse. All over the world and here at Michigan, when confronted with the deadly beast of a virus, nurses stood up, showed up, and delivered. Who else could have stood so tall and so strong? Of course, this is the year of the nurse. So with a new perspective and lens of great admiration and respect, I wish you a happy Nurses Week. It is not the celebration you all deserve, but I salute you and I stand beside you, heartful and with gratitude. I cannot imagine a better group of colleagues to stand with for the fight of our lives, and I can think of no other nursing community better suited and equipped to lead the way to our future. Thank you, every one of you, the greatest team in healthcare, the nurses of Michigan. Happy Nurses Week.